Hey guys, I'm Zivan, your host for today. So people, what's the first thing that comes to your mind when people say emergency? Is it needles, is it blood, or people shouting help, or handsome doctors? And that's how a love story begins. Jokes aside, I'm a person grown up watching New Xiao Yan Sam, so I always wonder, is it really true what we see on TV dramas, movies, Grey Anatomy, or even TVB is really happening in real life? So people, please join me to meet Dr. Jerome, medical officer in an emergency department from Gleneagles Hospital Penang. Dr. Jerome, thank you so much for your time. So the whole purpose of this is to help us to understand more about your department, and also it will help us to set the expectation right when we visit your department. This is out of curiosity lah. Being a doctor yourself, do you watch all these movies about doctors? Will you be like, come on, this is not real, this is not happening in real life?
Sometimes I mean, all these are just dramas and just for passing time. We just watch it, and yeah, it's not. Some of them are not real, but it's entertaining.
Okay. So people, you have to do your own judgment when it comes to watching movies, right? Okay. So we're gonna start with very basic question. Tell us, what are the tasks as an emergency department doctor, and how can I be benefited when I visit an emergency department when I'm feeling unwell?
Right, so in the emergency department, usually we are called medical officers. Right, so we are the first line of treatment over there. So when you first come into the hospital, you come to the emergency department. We are open 24 hours. If you are unwell or anything, we will assess you, we will consult you and see what's going on. If it's needed, we will do some blood investigation or some scans to further help us to diagnose what's going on with you. And from there, we can give the proper diagnosis and we can give the proper treatment as well.
So moving on to the next question, how do I know when do I need to see an emergency department doctor? Like whether am I serious or I'm still okay, I can still delay a bit until when I have more time, then only I see a doctor? When?
In my opinion is that when you're feeling unwell or you have pain anywhere, just don't feel yourself. You can actually just drop by the emergency department, at least have a consult with the emergency doctor and see what's going on. If it's not urgent or emergency, then we will give you an appointment date to visit one of our consultants the next day or the following days.
Okay.
But if it's emergency and you're at home, then it's going to be a big problem if you wait until the next day.
True. I mean, especially when there's life-threatening, deep cut, blood bleeding non-stop.
You wouldn't know.
Yeah, and I don't, stuff like that, I don't think that you have a reason to not visit an emergency department doctor, right?
Yes.
Yeah, okay. So moving from there, we understand that once we got ourselves into the emergency department, we'll have to register ourselves at the registration counter, and then there's another counter, as I know. So once we register ourselves, what's next?
After registration, we will put you in a waiting corner, and the counter that you mentioned just now is called the triage counter. So the triage counter is actually to assess your severity, your condition, how severity is it. So we have from non-urgency to emergency cases. Then from there, the waiting time varies from there.
So there are like green, yellow and red columns in the triage?
In the triage, we have this color coding is for us to easily assess your condition. So for red cases, it's that those patients that are very critical, that needs attention straight away, so will be brought in from the triage counter straight away to the red zone. That's what we call red. Yeah, so will be attended by the medical officer straight away. Then we have the yellow zone, which is the semi-critical. Semi-critical cases, we will attend within 10 to 15 minutes based on the severity as well, and also the condition of the emergency department. And those green cases are for those like non-emergency cases that patient just came in to, for a fever and so on like that. So we have time, not to say that we are delaying, it's just that we will settle the rest of the emergency cases first, then we will attend to those green cases.
Can I ask the time from immediately to up to?
Immediately up to 90 minutes. We will try to manage everyone in 90 minutes. Sometimes our emergency department will have a lot of patients, heavy loads and so on, but we still manage to do them, under 90 minutes.
Okay, thank you, Dr. Jerome. So, ladies and gentlemen, that's all for today. Thank you so much for watching.